Lithium, discovered in 1817 and the latest of all metals, has recently been found to have widespread benefits on mental disorders within the last century. With just 3 protons, 3 neutrons, and 3 electrons, it is surprising that such a simple element can have such extensive effects on the human brain. Although its exact mechanism of action remains unknown, several hypotheses exist as to how lithium ions can reduce the effects of bipolar disorder, relating to different chemistry concepts we have discussed in class. You may be wondering exactly what bipolar disorder is. Well, bipolar disorder, primarily bipolar type 1, is a condition that affects more than 2 million Americans annually in which one experiences 2 major extremes, or highs and lows, in human emotion. First, there are episodes of mania, in which an individual experiences energized activity often characterized by a sense of euphoria or irritability. This stage can last weeks or even months. Then the individual can shift to the opposite side of the spectrum and experience a stage of major depression, in which cognitive and physical function slow and it can become difficult to complete important tasks. Long ago, before doctors fully understood this condition to the extent modern doctors do, it was believed that people that exhibited the mania of bipolar disorder were simply mad. However, it was noted that sometimes when these people bathed in the alkaline-rich mineral wells in Texas and other areas, these water bodies seemed to relieve them of their madness. Subsequently, these springs were labeled crazy waters due to their mysterious healing of these crazy people. Even in the early 20th century, lithium's effects were still unclear. From 1927 to 1949, 7-Up used to contain lithium, and advertised that it gave an abundance of energy, enthusiasm, a clear complexion, lustrous hair, and shining eyes. But people did not realize that lithium's ionic qualities contributed to this just yet. It wasn't until the 1940s that an Australian psychiatrist, John Cade, researched the benefits of uric acid on treating manic depressive illnesses in the form of its most soluble salt, lithium urate, in laboratory animals only to find most of the manic symptoms had disappeared. During the 1950s, a Dane, Molenschach, built off of Cade's research and discovered how the lithium ion could help relieve these manic depressive illnesses. His research successful, doctors everywhere began to prescribe lithium as medication for these illnesses in a lithium underground system, before the FDA fully approved the drug for American use in 1969. Lithium is most effective in aborting acute manic attacks and preventing further bipolar episodes after 6 months of being administered. But how exactly do these lithium ions work? Well, if you remember back to the aqueous reactions we discussed earlier in the year, alkali metal ions are, well, kind of boring. In most of these reactions, they're mere spectator ions, but in human physiology, these ions are anything but spectators. For instance, think of the sodium-potassium pumps that exchange materials across our cell membrane. Although lithium does not have an identified function in normal human physiology, it certainly can benefit those that suffer with bipolar disorder. First, lithium is typically given to a patient in the form of lithium carbonate or lithium citrate. Both of these compounds are ionic, and one of the properties of ionic compounds we learned earlier in the year are that they're soluble in water to at least some degree. As we've learned previously, alkali metals are easily soluble in water as well. Therefore, when lithium carbonate enters the human body, it quickly breaks down in water to form lithium ions and carbonate ions, as seen in the equation pictured. Therefore, the efficacy of lithium in treating bipolar disorder relates to 2 of the following learning objectives from our past chemistry units. First, learning objective 1.10 states, use experimental evidence to explain the arrangement of the periodic table and apply periodic properties to chemical reactivity, which relates to the topic at hand because the properties of alkali metals make them easily soluble in water and allow for lithium carbonate to break down quickly in water and exude its effects on the human brain. Learning objective 2.15 states, explain the solubility of ionic solids and molecules in water and other solvents using particle views to show intermolecular forces and entropy, which can be seen by the particle views represented on this slide. Now this is where things get fuzzy. The lithium ion's mode of action in reducing these bipolar disorder symptoms still remains unknown, but a hypothesis offers a possible explanation. The hypothesis states that the brain inflicted with bipolar disorder is characterized by either deficiencies in central monoamines, specifically norepinephrine, that can cause depression, or an excess that can cause mania. It appears as though the lithium ions might facilitate the norepinephrine uptake by presynaptic neurons, or can stabilize enzymes that degrade these monoamines. Other studies suggest that the lithium ions alter the function of certain neurotransmitters, which might contribute to its effectiveness as a drug. Lithium has been found to reduce the effects of acute mania, bipolar disorder, schizophrenia, premenstrual tension, hyperactive activity, violence, suicidal thoughts, and more. It can even prevent further bipolar disorder episodes. Typically administered in the form of lithium carbonate, a patient consumes 600 milligrams 3 times a day for acute disorders, but less dosage has been seen to have similar effects as well. Some side effects may occur, including those seen in the table pictured. The lithium ion has a 70% efficacy rate in those suffering from bipolar disorder, making it the most effective treatment in psychiatry, second only to electroconvulsive therapy. Thank you for your time, and I hope you learned a little bit more about the lithium ion and its chemistry as an alkali metal ion that allows for it to be used to treat bipolar disorder.